physiology, different anatomy, and that's why handling a pediatric patient should be different from handling adult patient, or thinking of this is a small size adult patient. الموست important topics اللي بدنا نحكي فيها بالبيدياتريك يورولوجي، هنحكي عن التستيكلز، هنحكي عن reflux, mosaico-urethral reflux، هنحكي عن posterior urethral valve, nocturnal enuresis, phimosis, paraphimosis, hypospadias, epispadias, and bladder extrophy. Undescended testicles is the first topic. إذا في حدا عنده أسئلة بيقدر يقاطعني ويسأل. Okay. Undescended testicles, it's where the testis is not locating in the scrotum, whether ectopic testicles or male-descending testicles. Usually, the testes develop high in the abdomen during intrauterine life, and it go downward to the or through the inguinal canal toward the scrotum at the end of the pregnancy, and the incidence is around 3%. Whether it's unilateral, it's more common than bilateral. طبعا. هلا growing baby with high testicles usually will have possibility of spontaneous descent of the testes with age. So the incidence drop from 3% at birth to 1% at the age of 1 year. That's why undescended testicles, usually we wait until the age of 6 months and more before doing surgery, as long as إنه في possibility إنه تنزل testis spontaneously. هلا whatever the classification of undescended testicles, whether retractile, ectopic, incomplete descent, or هاي the 3 types، احنا ما عندنا مشكلة. Usually we have to treat this patient similarly. We need to keep the testis in the scrotum at the age of 1 year, or between the age of 1 to 2 years. هاي اللي هي most common site for ectopic testicles or undescended testicles. Ectopic testicles, it means that the testis is locating away from the descending pathway. هلا there is a problem of having undescended testicles. هاي الأشياء مهمة، اقرأوها بعدين. هلا after birth, before discharging any newborn male patient, we have to examine the genitalia. Part of the male examination is scrotal examination to assess if there is testicles and no testicles. So we can diagnose undescended testicles immediately after birth. Treatment is surgical treatment. هلا الهرمونال treatment كنا زمان نستخدمها, especially if the patient have bilateral undescended testicles for a possibility of spontaneous descent. بس هلا من جديد كثير studies proven that hormonal treatment is useless in really undescended testicles. Surgery, it's orchidopexy or orchiopexy. هلا قبل ما نروح على next topic, why should we operate on patient with undescended testicles? Because there is a high possibility of atrophy. High possibility of malignancies, high possibility of trauma, and high possibility of torsion. So we should operate for orchidopexy. Orchidopexy is done between the age of 1 to 2 years. Why should we operate on undescended testicles? للأشياء اللي حكيناها. So to preserve fertility and preserve testicular growth, preserve or avoid torsion, malignancies, or trauma, and إشي كتير important إنه psychological issues on the patient to have single testicles. Now, second topic, reflux. Vesico-urethral reflux. It is regurgitation of urine from the bladder up to the kidneys, whether unilateral or bilateral. Normally, the urine should not go backward to the kidney. So if urine retrograde up to the kidney, it means this is reflux. 10% as incidence. Girls, it's 5 times than boy. Siblings of an affected child have a possibility of high or 40% of having reflux. هلا احنا بنعرف ال lower ureter attached to the bladder in a physiological valve that prevent reflux. So there is an intramural part of the ureter where the ureter pierces the bladder muscles and goes subtrigon and goes submucosally and open in the trigon. The length of the tunnel of the ureter in the bladder should be 5 to the diameter of the ureter, which is 1. So the ratio should be 5 to 1 that prevent reflux. لما يكون اليوريتر short insertion in the bladder or shortly inserted in the bladder, this means that the ureter may produce reflux. So high ratio should be preserved. If we do surgery to treat vesico-urethral reflux, we have to keep in mind to restore the 5 to 1 ratio حتى to prevent reflux. Primary or secondary reflux as a classification. Primary, it means there is no pathological causes that cause reflux. Secondary ممكن يكون في عنا neurogenic bladder or obstruction of the urethra ممكن تعمل back up pressure on the bladder, so the reflux may appear as secondary. المرضى اللي بيكون عندهم DSD هي اللي it means this detrusor sphincter dyssynergia, which means that the patient voiding against closed sphincter. So this will cause high pressure in the bladder that induce reflux. Complication. Reflux induce renal damage in 2 forms. The first thing, secondary to reflux of infected urine up to the kidney, lead to more or recurrent pyelonephritis. Pyelonephritis induce scars and fibrosis in the renal cortex. This scars إذا زادت بصير في عندنا more scars and more damage in the kidney. The patient end up with reflux nephropathy. So infection in the bladder with reflux, the reflux will take up the infected urine to the kidney and do pyelonephritis. Pyelonephritis will cause scars and then renal damage. الشغلة الثانية الووتر هامر إفكت. ووتر هامر effect زي المطرقة اللي بسموها إنه the urine will go high up to the kidney with high flow. This will hit the renal collecting system and then may lead to injury in the cortex of the kidney. هلا if we minimize a risk of bladder infection or cystitis. So we will reduce the risk of renal injury. If we reduce the bladder pressure, so we can minimize the water hammer injury from reflux into the kidney. So this is the role of conservative treatment in reflux. If we failed to keep urine sterile, if we fail to keep bladder pressure low, this means that the patient may end up with renal failure. So those are two indications for surgery. Usually, patient with reflux presenting with recurrent febrile urinary tract infection. So if you have a newborn baby, تفضل. هيك بعده رايح.
مش موجود السلايد، مش موجود، مش مبين.
طيب اوكي هلا برجع مرة ثانية بسيطة هاي. رجع هيك شباب؟
دكتور هيك ممتاز.
So patient with recurrent febrile urinary tract infection in pediatric age group, we have to think seriously of reflux. Patient presenting with renal impairment, pediatric patient, hydronephrosis, we have to rule out reflux. كيف نشخص الرفلكس؟ By doing MCUG، هاي اسم الصورة. Micturition cystourethrogram أو VCUG voiding cystourethrogram، هي نفس الصورة. الفكرة من هاي الصورة إنه we inject iodinated we inject contrast material in the bladder by Foley catheter slowly under gravity. بنعبي البلادر with high contrast material. هلا normally بما انه ما في اذا ما كان في reflux the iodinated contrast media should not go up to the kidney. In case of reflux, the patient will يعني حتطلع الماتيريال up to the kidney, so this indicates there is a reflux. According to voiding cystourethrogram, we diagnose grade of reflux and presence or absence of reflux.
دكتور السكرين برضه لاحظ.
حاضر. تمام. So MCUG or VCUG is usually done to diagnose. هلا الالتراساوند also is good to be done to assess the cortical cortex of the kidney. Two important or three important imaging in patient with reflux is ultrasound أول واحدة، MCUG or VCUG، والشغلة الأخيرة اللي هي DMSA. DMSA, it's a nuclear study that's used to diagnose if there is a renal scars or not. زي ما حكينا قبل إنه in case of recurrent pyelonephritis, the patient may develop renal scars. Scars will lead to more damage on the kidney, and this may end up with non-functioning kidney. So DMSA will diagnose if there is a scars or not in the kidney. MCUG or VCUG diagnose presence or absence of reflux, unilateral or bilateral reflux, grade of reflux. We have 5 grades of reflux. The first 3 grades is a grade low grade. 4 and 5 is a high grade reflux. يعني please احفظوهم هذول الجريدز، ما في داعي to go through، بس يعني احنا بنعتبر ال first 3 grades mild grade وال 4 and 5 is high grade reflux. In this image, this patient have bilateral high grade reflux grade 5. So بنشوف الكونتراست اللي عبيناه بالبلدر كله طلع up to the kidney. This is grade 5 bilateral reflux. Treatment, usually we try to keep patient on conservative treatment لأنه كل ما زاد العمر كل ما راح الرeflux. If we fail to keep urine sterile, the patient should go for surgery. We have two types of surgery: minimally invasive procedure, زي injection of some subureteric injection or reimplantation of the ureter. Hypospadias is the third topic. Hypospadias, it's a common صراحة pathology that appear in 250 live birth male patient. It's a ventrally locating meatus. Meatus will be located on the ventral aspect of the penis. We have 5 associations of hypospadias. احفظوهم. The first one is ventrally locating meatus. Second one is absent of the ventral hood, ventral foreskin. Penile chordae, which is ventral curvature of the penis. Absent of the penile ventral skin. والشغل الأخير اللي هي deviation of the median raphe to one side of the penis. كل ما زادت or the more the proximal the meatus, the more the severity of the hypospadias. إذا كانت in the mid shaft and distal, it's mild or خلينا نحكي mild hypospadias. Sorry, إذا كان خلينا نحكي coronal and distal, it's mild hypospadias. Mid shaft and more, it's more bad hypospadias. هاي الصورة indicating hypospadias, اليellow arrow indicating site of meatus. لاحظوا هنا إنه ventral penile skin is deficient, absent of the foreskin, بس موجود على posterior part. في عنا penile curvature اللي هي الكوردي، وفي عنا اللي هي deviation of the median raphe مش كتير واضحة بهاي الصورة. هلا whatever the site of hypospadias, surgery is the treatment of choice for those patients. الفكرة من السيرجري إنه to induce، أو خلينا نحكي الفكرة من السيرجري is doing cosmetic surgery and functional surgery to keep urine forward direction. Distal hypospadias usually does not affect fertility, while proximal hypospadias, that one which affect fertility because the patient will not be able to do seminal emission in the vagina. هلا لما يجينا بيبي او لما نفحص بيبي يطلع عنده hypospadias, especially اذا كان distal hypospadias or mild hypospadias, في عندنا 2 important things that we need to reassure the family about. The first thing, انه they should not do circumcision before the age of 1 year, and surgery or circumcision done at time of definitive hypospadias repair, which is usually done at the age of 1 year. الشغل الثاني انه we have to reassure the family that this congenital pathology will not increase the incidence of urinary tract infection, or it will not affect fertility or erection in the future. The proximal hypospadias is different story. Usually it's rare. We should refer the patient to a pediatric urologist to reassure the parents. Nocturnal enuresis. Enuresis, it's a passage of urine during sleep, or loss of urine during sleep involuntarily. Usually after the age of 5 years, we expect that the patient will be dry during day and time. So if he develop enuresis, it means, or he wet his bed, it means this is nocturnal enuresis. We have primary or secondary. Examination بالغالب ما في كتير أشياء، يعني بالغالب بيكون everything in baby with enuresis بيكون normal. Treatment, behavioral modification is extremely important by providing reassurance, bladder training, motivational technique. كثير مهم الموتيفيشن to improve child self-esteem. Conditioning therapy زي alarm device which is usually connected to the child underwear during asleep. مجرد ما ينزل urine, the alarm sensor will alarming the baby to wake up, and then he go to urinate in the bathroom. هلا الميديكال تريتمنت احنا في عندنا only one drugs اللي بنستخدموه هو الديسموبريسين. ما بنستخدم الترايسايكليك انتي ديبريسنت. So desmopressin is usually the single drug that's used to treat nocturnal enuresis baby, usually given in a sublingual tablet 1 hour before going to bed. Posterior urethral valve is rare pathology. مش كثير مهم ندخل بتفاصيله، بس هو there is a congenital valve locating in the prostatic urethra only in male patient. ما في posterior urethral valve in female. The valve will induce obstruction of the urethra. This obstruction will lead to high pressure in the bladder. This high pressure will back up to the kidney, inducing renal failure. The presentation of valve depends on the severity of obstruction. The more the bad the obstruction, the baby will be incompatible with life because he will have oligohydramnios and multiple congenital, multiple bony pathologies. Mild valve usually presenting later in life. الأكثر إشي we detect اللي هي moderate valve that usually identified during antenatal ultrasound. هاي الصورة for a baby who born with هاي الصورة for a baby who born with posterior urethral valve. So we can see the valve is obstructing the posterior urethra. هلا posterior urethral valve diagnosed by MCUG. MCUG usually should be done or should be diagnosed the valve during the voiding phase. لازم نعمل أو نستنى لحد ما البيبي to void during the image. إذا ما كان في voiding ما حنشخص هاي الصورة. لذلك هاي الصورة اللي شايفين فيها البلدر filled with contrast material والdilated part اللي تحت هذا هو prostatic urethra. It's dilated, so the baby once he void he will show a dilated prostatic urethra, and الرينج هاي موجودة بالصورة هي البلادر neck. So this is a typical mild posterior urethral valve. إذا كان bad valve بالغالب تعطيني high grade reflux, trabeculated bladder and bilateral reflux. Treatment after we diagnose valve intrauterine antenatal for the ultrasound. Immediately after birth we do ultrasound to confirm, and then we do MCUG. إذا كان في valve واضح we do أول شيء catheter insertion in the bladder to drain the bladder and to minimize the pressure in the bladder. So we minimize the pressure اللي بيرجع على الكدني. Then we do valve fulguration by resectoscope. So the treatment is fulguration of the valve. نشيل الvalve and we relieve the obstruction. طبعا fulguration of the valve, imagine إنه newborn baby عمره يوم أو يومين بدنا نعمل له cystoscopy, very fine urethra, very meticulous instrument. So it's extremely difficult. Procedure should be done by expert pediatric urology. Bladder exstrophy is extreme rare pathology. مش كتير نعرف تفاصيلها، بس bladder exstrophy mean it's absence of bladder coverage. ما بتكون في any abdominal wall coverage, لا muscles, لا skin, or any abnormal, any bladder muscles. So the bladder will drain directly to the abdomen. The treatment حتكون واضحة زي عين الشمس. لما يجينا baby with bladder exstrophy حتكون واضحة زي عين الشمس إنه the bladder is open, the urine is draining outside. Treatment of those patients, we should cover the bladder mucosa with gauze or with wet sponge to avoid dryness of bladder mucosa, and then we should refer this baby to a tertiary centers to deal with this patients. زي هيك we have to refer this patient immediately. هاي هي البلادر extrophy. اوكي. بلادر الابيسبيدياس تقريبا نفس الهايبوسبيدياس، مش it's a rare pathology, but if you have an epispadias يعني هي extremely rare بصراحة. بس if there is a high epispadias it means that the meatus is locating on the dorsal aspect of the penis axial hypospadias. التريتمنت تقريبا nearly the same as hypospadias. We have to wait until the age of 1 year for urethroplasty by keeping the urethra in normal orthotopic positions. مش كتير ضروري نعرف تفاصيل عن الابيسبيدياس وعن الاكستروفي، بس we have to know definitions of them. Phimosis, paraphimosis هذول two important conditions rare احنا عندنا ما بنشوفهم لانه الفايموسيس والباراphimosis احنا لهم نعمل circumcision. So phimosis it's mean there is tight foreskin, so the foreskin will not be able to be retracted backwards زي هاي الصورة. هلا في عندنا two types of phimosis. Physiological phimosis هاي usually with time بتروح لحالها or can be treated with cortisone or corticosteroid creams. If not improved, we do circumcision. Pathological phimosis usually secondary to scars in the foreskin, so the patient will not be able to retract the foreskin backward. The patient need the treatment of phimosis is circumcision. هلا الفايموسيس ايش ممكن تعمل recurrent infection، بتعمل collection of infection and bacteria underneath the foreskin, so the patient may develop recurrent urinary tract infection. هاي الشغله الثانيه ممكن during voiding يصير في ballooning of the foreskin. يعني بتخيل الواحد ببول بصير عنده as long as the foreskin opening is tight, so بصير في ballooning of the foreskin. Paraphimosis is a serious pathology. كيف الفايموسيس بيكون tight foreskin. So if we retract the foreskin backward and we lift the foreskin backward retracted بصير في زي ring على الglands. This ring will increase with time because of the edema, so the patient may develop gangrene or necrosis of the glands. Treatment of paraphimosis is a circumcision. So treatment of phimosis and paraphimosis is circumcision. احنا بالعاده ما نشوفهم لانه we do circumcision. هلا sexual dysfunction مش كثير important تدخل فيها. قديش ضل معنا وقت شباب للميتينج؟
5 دقائق دكتور.
ان نعمل ميتينج مره ثانيه نقدر ندخل مره. يلا خلينا نكمل، نقدر ناخذ اليوم. يلا اوكي.